Good evening, sir.
Very good evening, everybody. Meeting again in the session of Materia Medica, and today we're going to learn one of the important remedy in our practice. That is the Arsenicum Iodatum. This remedy is not explained by Allen. That's why today we're going to learn it from Borix Materia Medica. But before going to the remedy, I will share three cases. In fact, this is a remedy which is very oftenly used but overlooked many times. We used to come closer to it by considering arsenic, but many times we miss the Ars Iodide. And that's why I will going to share the core of the remedy in today's session. First important case was very old man, 65 years of old man, who was brought to me, who had since childhood 4 times tuberculosis and had consumed the anti-tubercular treatment, and now came to me with the hemoptysis again. And he was having bronchopneumonia, and he was again asked to go for investigations and start ATT again by doctors, but he refused because he has become so weak that he doesn't have a capacity to face that again, and that's why he was brought to me. So patient, when I observed, there was hemoptysis with him. It is a bright red blood, evening rise of temperature. Then there was night sweat, and he's used to sweat a lot whole night, and which has produced tremendous weakness in him. But because of that, along with that, he becomes so restless, breathless, specifically with difficulty to expectorate. Whatever is there, it used to remain over there, phlegm, and he doesn't have strength to throw it away. Um, Voice was lost, as good as aphonia. He used to talk in a very, very mild tone, very mild. So I have to ask question 2 times, 3 times to him. He said that he was not able to walk so much if he has to climb the stairs. In fact, in my OPD, one has to climb the 2 stairs, but that was rather difficult for him. So this was a case of active tuberculosis. And second important thing was he was having hemoptysis. Then when I examined, he was found to be having tremendous tachycardia with very feeble, weak pulse. And that second important thing, he was found to be having severe senile weakness, exhaustion, prostration. The restlessness associated with breathlessness, associated with active tuberculosis, the first remedy always comes in our mind, and it should come in our mind, is Ars Iodide. But there was a hemoptysis that was very marked, and it was bright red blood. No one should dare to give the phosphorus in active tuberculosis because it used to produce a very severe aggravation. How I have managed this case? I have given him first the Acalypha indica. Acalypha indica in 30 potency I have given for 2-3 days and asked him to come back. Acalypha indica is a wonderful remedy in active tuberculosis, or along with the hemoptysis, where arterial blood is there in the hemoptysis. It also has the drenching night sweats. So I have given Acalypha indica in 30 potency, and he when he came after 4-5 days, the hemoptysis was stopped. It was good sign, but weakness was marked, cough was there, he was difficult to expectorate. Rest of the features were there, but his hemoptysis has stopped very easily. It is a wonderful remedy to stop the hemoptysis in tubercular patients. And then I have given him Ars Iodide. I have started Ars Iodide in LM repeatedly. It is a pathological case, and I expected if 30 might have caused the trouble in him in his case because his susceptibility was very low, and that's why I started the Ars Iodide LM1 in repeated doses to him. To my surprise, when I asked him to come after 15 days, he got the strength. In fact, he was looking absolutely different. In first consultation, he was a lost case. If you look towards him, his face was absolutely lost, absolutely what you can say, prostrated, exhausted, lost hopes, such type of. He was too good. So that was very important thing which I have observed after 15 days. And I have continued him on Ars Iodide, LM1, LM2, LM3, gradually up to the LM15 also. Every 15 days I used to change. And he recovered so nicely that the expectoration stopped later on, the cough has stopped, he gained the weight, the night sweat stopped. In fact, without any anti-tubercular treatment, he completely settled. I asked him to take the proteins daily. I asked him to consume one egg daily along with this. And being a Muslim, their regular diet was twice in a week they used to eat the non-veg. So that was good for him. And he regained the weight also and he recovered from it. And fever also lost. So that was a good case where I dared to give the homeopathy for the active tuberculosis. So that case I wanted to share with you. So, but don't forget about Acalypha indica. Read that remedy from the even Borix Materia Medica. It is given in Borix Materia Medica and nicely explained over there. Second case was a psoriasis case. It was 30 years male who was brought to me with a active psoriatic lesions and he was having severe dryness of the skin. It was looking like the ichthyosis associated with the psoriasis. Tremendous dryness of the skin with psoriasis, lot of scaling was there. The eruptions were absolutely dry. Most important thing along with that, even with this dryness, even with this scaling, all those things, this fellow had two important things. It is associated with the glandular enlargements in the or lymph nodes enlargement in the groin as well as in axillary region. He was having more eruptions on the extremities, and those were typical with this patient. Third important thing was that he was getting sweating at night, tremendous sweating at night. Three important characteristics led me to prescribe him for arsenic iodide. I have started him in his case. I have started with Ars Iodide 30 directly. I have given him 6 doses of 30. First day 3 doses, next day 3 doses, and I have continued with him on the placebo. When he came after 15 days, scaling was much better. Then again, I have continued with the same. After 30 days, when he came, he was very good. The eruption started drying up and scaling was reduced a lot. And within span of 3-4 months, he was literally covered with the help of Ars Iodide 30. So whenever the psoriasis is associated with scrofulosis, one must think about the Ars Iodide. This is my suggestion, and patient is generally the patient is hot. So one should not miss the Ars Iodide in such types of cases. The third case was, it was a case of chronic rhinitis. It was young child, six years old child who was brought to me with a recurrent coryza. His mother told me that, doctor, since long time, 2 years, we were treating him with recurrent coryza and he is not getting settled. He was so restless in the OPD, not able to sit in one position, continuously moving here and there. And she said that this is the same nature he is having everywhere. Even in school, he cannot sit in one place. That is his problem, because of which he cannot concentrate. He is having coryza which was thin, acrid. His nose was irritated, completely excoriated. Discharge was sometimes watery, sometimes whenever it stops, it used to produce a thick greenish discharge. But both of them excoriates the nose, and that's what was observable over there. And she said in the morning he used to sneeze a lot. And every time, whenever there is change of weather or whenever the cold is coming, he used to suffer a lot. Most important thing which she has told, doctor see this, and she has shown that there were bilaterally the lymph nodes were enlarged. Cervical lymphadenopathy was there. Then when I asked anything do you have, and he said that I have pain over here at the root of nose, at the glabellar point or at the root of nose. He was having the pain whenever the watery coryza used to stop there, he used to get that pain. That was another important thing. And his nose was looking absolutely red and swollen and excoriated. So coryza, thin watery or thick greenish, associated with scrofulosis, cervical lymphadenopathy, with tremendous restlessness. Generally, even though the patient used to suffer from chill, he used to be a hot patient. He never keeps the covering at night. And that was very specifically mentioned by his mother, that he never keeps clothes on his body. Is very typical of Ars Iodide. I have started him directly on Ars Iodide 30, few doses followed by biocombination 5, and he has continued treatment for nearly about 6 months. And during this 6 months period, he recovered so nicely from it. Intercurrently, I have used during the summer season the tuberculinum 1 dose. This tubercular diathesis is very characteristic of those people or those children, and that's why intercurrent tuberculinum always helps in such types of cases. So these were the 3 cases which are very important. Let us go with the boric sumatra medica. Open the arsenic iodatum, iodide arsenic. It is to be preferred for persistently irritating corrosive discharges. He started with the discharges, and those are persistent, irritating, and corrosive. The discharge irritate the membranes from where it flows and over which it flows. So wherever discharge, whether it is nasal discharge, whether it is leukorrhea, whether it is discharge from the eyes, everywhere, the discharge may be fetid, watery, and mucous membrane is always red, angry, swollen, itches and burns. So this is typical whenever you used to see even wounds, skin eruptions are there, and if they are oozing, they are having the similar type of discharge. This is good remedy for influenza, hay fever, old nasal catarrhs, and catarrh of the middle ear. So coryza, chronic coryza associated with ear complaint. This is one more remedy one should not forget, along with lymphadenopathy. Swelling of the tissues within the nose, hypertrophic conditions of eustachian tubes, and deafness. This one should not forget. The deafness is associated. Merc dulcis, one more remedy one should not forget along with this. Whenever eustachian deafness is there and problem is with the ear is there, Merc dulcis along with this remedy plays very vital role. Senile heart. This is very important remedy for old persons where the heart is weak, the congestive cardiac failure, myocarditis, the fatty degeneration. Pulse is short, pulse is shorty, chronic aortitis, epithelioma of the leaf. This remedy covers the tubercular miasm, cancer miasm, both. Even it is wonderful remedy for cancer of the breast and cancer of uterus. It has been given cancer of breast after the ulceration has set in. Ulcerative stage of cancer, one more remedy one should not forget is the Asteria rubens, ulcerative stage of CA breast. Ars Iodide is also good remedy for ulcerative stage of CA breast. It seems probable that the Ars Iodide we have remedy most allied to it manifestations of tuberculosis, In the early stages of tuberculosis, even though there is an afternoon rise of temperature, Ars Iodide is very effective. It will be indicated by the profound perspiration, rapid irritable pulse, recurring fever and sweats, emaciation, tendency to diarrhea, chronic pneumonia with abscess in lungs. Chronic pneumonia with abscess in the lungs. Lung abscess is another important thing which one should not forget. Hectic debility, night sweats. Night sweats causing more debility, producing prostration because loss of vital fluids causing more weakness. So hectic debility, thakaunari. Hectic means thakaunari. This remedy is also to be remembered in thesis with horse racking cough and profound expectoration of purulent nature, and attended with the cardiac weakness, emaciation, general debility, a chronic watery diarrhea in physical subjects. See, thesis tuberculosis, active tuberculosis associated with chronic diarrhea, one should not forget. In cases of emaciation with good appetite, appetite is good, but weakness is marked, emaciation is marked. In amenorrhea with anemic palpitation and dyspnea. In chronic pneumonia, when abscess is about to form, great emaciation, arteriosclerosis. See the pathology in this remedy. If you are able to catch this pathology, then you will understand the miasm in a better manner. Arteriosclerosis, the myocardial degeneration, and senile heart. George Vitulkas has very specifically mentioned about this, that weakness in the heart, the myocardial degeneration, the cardiomyopathy, this is a wonderful remedy to be utilized. Threatened pyemia, like pyrogen, the methylene blue, these are the remedy. Head vertigo with tremulous feeling, especially in aged person. So good remedy for the aged. Nodes, yes, all features which you used to get very commonly in your practice. Thin, watery, irritating, excoriating discharge from anterior and posterior nerves, sneezing. There is hay fever, irritation and tingling in nose, constant desire to sneeze. Chronic nasal catarrh, swollen nose, profuse, thick, yellow discharge. Ulcers, membrane sore and excoriated, aggravation by sneezing. So acute hay fever, again this remedy is a wonderful remedy. So it is not just acute remedy, or it is not just a chronic remedy. It is useful in both types of cases, acute as well as chronic. So this remedy is a very useful remedy in acute practice also. Throat, the burning in pharynx, the tonsils are swollen, thick membranes from fauces to lips. Breath is fetid, glandular involvement, diphtheria, chronic follicular pharyngitis. So whatever may be present is associated with the glandular enlargement. That is very important about the Ars Iodide. Eyes and ears, scrophulous ophthalmia, otitis with fetid corrosive discharge, thickening of tympanum, burning and acrid coryza. Here again, if there is a ear infection, the glands below the in the neck area, they are always enlarged. Stomach pain and pyrosis, vomiting an hour after food, nausea, distressing, pain in epigastrium. Intense thirst, water is immediately ejected. Gastritis is associated many times in arsenic. That is an arsenic totality impact. Respiratory, yes, these are the meaning. Slight hacking cough with dry, stopped up nostrils. Pleuritis exudative. Pleural effusion is there. This is very important remedy. Tuberculosis with pleural effusion, chronic bronchitis, pulmonary tuberculosis, pneumonia that fails to clear up, bronchopneumonia after grippe. Grippe means common cold cough of hay fever type. Cough dry with little typical expectoration. Aphonia, that is very important. That is because of weakness. Loss of voice is because of weakness. Fever, recurrent fever and sweats, drenching night sweats, given in italics, has the meaning. Pulse is rapid, feeble, weak, irregular, chilly, cannot endure the cold. Skin, dry, scaly, itching, marked exfoliation of the skin in large scale. That's why it has a very close role in psoriasis. leaving a raw exuding surface beneath. Ichthyosis. Ichthyosis is very tremendous dry skin, fishy scale. Enlarged scrofulous glands, venereal bubo. Bubo is pus formation in the lymph nodes. It's called as bubo, specifically in inguinal lymph nodes. Debilitating night sweats, eczema of the beard, watery oozing, itching worse by washing, emaciation, psoriasis. See, given directly, psoriasis. Psoriasis is a word very important over here. Acne, hard, shorty, indurated base with pustules at the apex. So, pustular acne, cystic acne with pus at the tip, that is very typical with Ars Iodide with induration, hardness. Induration is hardness. So, see, all those features associated with scrofulous diathesis, all those features associated with the sweating at night, all those features associated with hotness. Arsenic is chilly, Ars Iodide is comparatively hot. Even though there is a tendency to catch cold, it is hot. This remedy is a wonderful remedy. See the remedy relationship, compare tuberculinum, antimonium iodatum. In favor, compare the Aralia, the Naphthalia, the Rosa D, it is. And lastly, the Sanguinaria nitrica. Dose is specifically explained by Boric, but I never used to follow every time Boric. Second to third trituration ought to be prepared fresh and protected from blight. Continued for some time, clinically it has been found advisable in tuberculosis to begin with the 4x and gradually to lower to the second X trituration, 5 grains 3 times a day. Better potency to be utilized in pathology is the LM. You can safely repeat that in LM. And you don't have stress to repeat in LM scale. So this remedy either you use in LM or in low potency. Don't go for high in Ars Iodide. That is my suggestion to all of you. It's a remedy which you should generally used in LM or low potency. Second, one more feature which is not mentioned over here, but the George Vitulkas has mentioned very specifically. It is good remedy for cancer of uterus. So this thing, cancerous diathesis, tubercular diathesis is very important in this remedy. So this is a most important remedy in our Mater Medica. One should not miss and one should not forget and use in practice. So we have discussed one more remedy from the third year syllabus. We'll go ahead with another remedy in tomorrow's session. If any queries are there, yes, we definitely have a time. We will discuss. Otherwise,
Sir, in
yes,
cardiac myopathy,
yes,
but the symptoms, if not tally, can we give this thing?
no,
In cardiac myopathy, the symptoms, no, it is not projected. If it is admitted in the hospital or something, no.
hmm.
Uh, most of the symptom what you are saying is not here. At the time, can we administer this
No,
also?
no. Symptoms should match. Most important thing is that it is not the directly on the pathology we're going to prescribe. We're going to prescribe what the patient presents. Whatever may be the patient's complaints, those you have to take into consideration and find the remedy. So my suggestion is that whatever the symptoms are there, you catch those symptoms and repertorize or find it out a remedy for those symptoms. Not on diagnosis.
Okay, sir. Thank you, sir.
Okay, anything else? Any query regarding Ars Iodide? So we'll conclude today's session. We'll meet again tomorrow same time with another new remedy from the A series, and then we'll turn towards the B. So that's all for today. Good night to all of you. Yes, Nidhi.
Sir, how to differentiate in between the tuberculinum and Ars iode?
Yes, tuberculinum is a nodule, first important thing. Ars Iodide tuberculinum having very close picture. But tubercular childs, generally, they are very mischievous. They are very, very active. Activeness is there both in Ars Iodide and tuberculinum. Both are having hectic activity that is characteristic of them. But tuberculinum, they are obstinate. Tuberculinum child generally have tremendous obstinacy. They never wants to sit in one place. They always wants to travel, wander. They are troublesome child, problem child. Ars Iodide is not a well-proven remedy at the mental state. You will get only restlessness of Ars Iodide, that's what. You're not going to get the whole mental picture of Ars Iodide. But exactly opposite is there with tuberculinum. Tuberculinum, we have a thorough picture of tuberculinum as a child. And these are children, either they are very intellectual, very inquisitive, or at the same time very dull also. Both sides of the coin are present in tubercular children, and that's why they are called to be a problem child. The tendency towards the bleeding is always there with the tubercular children. Tuberculinum, it is much more marked over there. Both of them are having the similar tubercular diathesis constitution. Looks very similar, tall, slender, weak, emaciated, narrow chested. That's common with both the remedies. But tuberculinum, all those mentality which you can catch very easily. They are very irritable children. Used to get irritable on trifles. Anger is violent, and they can even, so many times they are destructive over there. They are not the affectionate child. Here, in case of arsenic album, you are going to get generally the arsenic element and the cancerous diathesis associated with tubercular diathesis. You are going to get a little bit affectionate children, but tuberculinum, they are not at all affectionate. Okay, anything else? Any question? So that's all for today. Good night to all of you. We'll meet again tomorrow. And thank you.